You're watching Public Comment every Thursdays at 8 a.m. The live stream. Detroit is different and Bridge Detroit. Local politics of Detroit. All right. Welcome back to Public Comment. This week, we definitely are talking a whole lot about a notice that I got in the mail, and actually my co-host got in the mail, and you probably may have it in the mail or it's coming soon. It is a notice from the Detroit Water and Sewage Department saying that there is lead in the pipeline or possibly unknown materials, but we're going to break that down. And we even have a health expert, one of the ones I definitely think when it comes to anything health related that I'm relying on, because people are frantic right now. Malachi, how you feeling?
Not great. Not great. I got my letter in the mail. I have a 100-year-old house on the east side that we moved into in March. Yeah, I got a lead service line as well. I don't know, man. I'm looking up how to get a free test kit from the city this morning. I'm thinking back on how there were some repair crews in our neighborhood over the summer, and I'm pretty sure I got a notice from DWSD saying that I could sign up to get my water main replaced at that time. I don't know, man. I guess I missed my opportunity. I don't know when they're going to come back through. I'm just kind of sitting with the reality now that I have to find out how to keep myself protected.
Yeah, welcome to Detroit City. Welcome to Detroit City, as they would say. Man, oh man, it's stuff like this that is so classic Detroit. And before we bring up the great Dr. Jesse Brown that I said that's going to speak to us about this, we're going to get into some of the breakdown of what this is. All right. Was the safety of this. Okay. And when I talk about the safety of this, the biggest thing that I thought immediately was like, how can I remain safe. What should I do? It was like, you need to test the water, you need to test yourself, and then how often should I be testing the water? How often should I be testing myself? Anything holistic. The person that I think is best, if you watch The State of Black Detroit, and the person that speaks on health for that is Dr. Jesse Brown, who's ran a holistic center for decades, and one of the people that I know, just the proof is in the pudding, one of the healthiest people I know. So without any further to do, I want to bring up Dr. Jesse Brown to speak a little bit about this and make some type of sense of this. So, Dr. Brown, how are you doing today?
Oh, I'm doing great today.
Okay.
And I've got my letter too. Yeah.
Mm,
So yeah, and this is a problem that's not just Detroit. And it's, fortunately, and they say it's different than Flint, but it's something that affects all of us because everyone drinks water. At times in our history when a lot of people had health problems, they said it must be in the water. Why? Because it doesn't matter where you come from, what part of the world, everyone uses water for bathing, for cooking, for whatever we do on a regular basis. So water is vitally important. And it's it's one thing that connects us. And it may very well be the first thing or one of the first things that we need to do fundamentally to take care of ours and our loved ones' health and well-being. Okay. So what we're talking about in this case is lead, and they say it, and it could be other unknown substances. But let's just talk about lead and heavy metals. Lead and heavy
okay.
metals.
Wait,
Okay.
before you get there, I want you to
Yeah.
give
Okay.
us a brief background of some of your information, because I know people are like, okay, Kari's uplifting this guy, but
Oh,
give a little
okay.
bit of background so people can kind of know contextually,
Yeah.
some of your experience
Okay.
in so many things holistic and health and looking at
Sure.
natural ways of healing.
Sure. I'm a naturopathic doctor. I operated a clinic, as you said, for decades, for over 32 years. We saw over 60,000 people, particularly in regards to cleansing, weight loss, different natural methods to cleanse and improve our health and well-being. How do we eat? What things do we avoid? To keep from being poisoned, from poisoning ourselves, and the air, the food, the water, etc. I've been on this path for a very long time, since I was in my late teens to early 20s. And it became passion for me. I wanted to help my family and loved ones, and it grew into a profession even after I completed my undergraduate degree. So my studies, my background, my doctorate is in natural or holistic health. The area is called naturopathy, or taking the natural path. And when it comes to water, I've been buying water or now using water purification systems for most of my life. And so I've studied this pretty extensively for personal reasons, and because it was a way to serve my community.
Thank you so much. And I'm so grateful for knowing you, Dr. Brown. And now we can get into some questions, because I know the first thing that Malachi was saying was a lot of questions that I had directly for you.
Okay.
And we want to get into that. And I have some questions
Sure.
myself. Um,
Okay.
let's break it down when you talk lead and water.
Yeah. Okay. So lead is the heavy. So first of all, when it comes to water, chlorine, fluorine, lead, mercury, a number of different chemicals, things that combine with other things to cause health problems like cancers and all types of things. Those can be present in the water, and it comes from industry. It comes from so many different things going into the water, in addition to the pipes in the system that services our homes and our businesses. Right? Okay. So having said that, one of the categories of concern about contamination or contaminants in the water is heavy metals, lead, mercury, arsenic, etc. Okay. In this case, lead, and then perhaps some other unknown substance. Lead is a heavy metal. They did test, and they are testing the water in Detroit and other cities, and they say we have acceptable levels of lead in the water, which is something like 0.9 parts per billion, which they would say is really low. There are some of us that will say there are no safe levels of lead, for the human, that would go into the human body. No safe levels. So you want to get it as low as possible. If they gotten it down to 0.9 or, parts per billion or whatever, what else can we do? What do we need to do to reduce that to as close to zero as possible? And that's where we get into water purification. Do we buy our water? Do we purify it or whatever? I think the first line of defense is to get a water purification system. Ideally, whole house system. If you own a house, if you're not renting or something, a whole house water purification system, because that's going to interface with where the water comes in your home. And then when you the water that you're drinking, the water that you're cooking with, then there would be another, for example, reverse osmosis is probably is definitely one of the most effective, maybe the most effective system for purifying the water that you're going to drink and cook with. So you got one level of purification and filtration coming into the home, and then this is going to affect all the water that's in your home and reduce all of that, including your shower water, that which you would bathe with, etc. And then you have another system that would be for drinking and cooking more specifically, and that would filter the water down even more precisely.
I have this question for you.
Yeah.
For people that know, even I have a cousin that's almost like an uncle in age that
Okay.
did a lot of studies in the 70s about the impacts of lead on specifically young children and their behavioral issues and what it can do to your central nervous system.
Yeah.
And you making decisions, and there's like so many ties between, at one point in time, saying that you have a predisposition towards comprehension, you have a predisposition towards cognitive ability, and so much can be happening if lead is in you. What's the impact of if too much lead is inside of? A lot of that was done on children, but just people in general. What are the health impacts of that?
Yeah. Okay. So the effects, even at the low levels that they're claiming, it's the cumulative effects that happen over time. Okay. So an accumulation, lead exposure, and accumulation of that will affect us neurologically, our circulation, circulatory system, all, pretty much all systems of the body. But many of the studies have focused on the neurological impacts, how it affects the brain development in small children. So you have small children and the elderly that are a particular risk. And then people in underserved communities and poor communities where, the policies and the politics tend to neglect and overlook their exposure and the problems that may be in those particular communities. But it affects us neurologically, circulatory system, the renal system, skeletal system, even the reproductive system. Okay, because these metals accumulate in the body and they interfere with its functioning on different levels. And we saw that in Flint, and we've seen that in other major cities around the country as well.
All right, I've had a lot of questions for you thus far, but I know Malachi probably has a question or two himself.
Okay. Yeah, I mean, the main thing for me, we look at the annual testing that the city does, right? And it's below I believe it's 15 parts per billion, the 90th percentile of homes are below that. So, broadly, the city is saying that there's not a problem of, high exposure to lead, although we've noted already that any amount of exposure is, is worse than none, let's say. Yeah. My question really is like, for people that receive this letter, and are probably going to be doing some home testing themselves to find out what, where their actual range is at. I mean, how much variation do you think there actually is house to house, neighborhood to neighborhood in terms of actual lead exposure? Because when the city does these annual tests, they don't test every home in the city. They test, a certain amount that's meant to be representative of the city as a whole.
Right. They're gonna do a sampling, and I believe they're gonna do a sampling for residences as well as businesses.
Mhm.
I don't know what the variations would be. But it would behoove anyone who can afford to, and much less desires to, get their water tested, to have it tested to see what's in there. Now, if they do a comprehensive test, it won't just be for lead or heavy metals. It should be chlorine, fluorine, lead, the heavy metals like lead, even something called THMs, the more thorough ones, and that's trihalomethanes. And so you can find out about, what chemicals are in there as well. So lead is absolutely a concern, but I would also caution people and encourage people to pay attention to all the things that are in there, because cumulatively they have a damaging effect on our body, on our immune system, and our ability to resist or recover from illness, etc. But I don't know what the variation would be from home to home. I have no idea on that, though.
Yeah. I mean, I feel like the significance of this really is that the letter has disclosed to people who may not have known
Mm-hmm.
that they are connected to a lead service line.
Yeah.
And,
Mm-hmm.
I don't know. We're talking more about kind of steps to take, to make sure that you and your family are safe. I'm still kind of wondering, like, why did I not know this before? Why are so many residents like surprised by this information if it was held in some kind of government list that made it easy for them
Mm-hmm.
to put out in a mass mailing like this? Because I think for a lot of folks, this is the first time they're probably, being forced to acknowledge this, even though I think we all kind of know that, lead is an issue in the city. There's a lot of older homes. Anything built before
Yeah.
1945, they say, is likely to have a lead service line, on and on and on.
Mm-hmm.
But what I think is shocking to people, who are reacting to this is their, it's the surprise of not knowing that their line was lead. And maybe I'm projecting because I'm surprised, but
Well, we have a 300-year-old city, and of course the lines, our water service lines are not that old, but we have an older city than some, and so the practice of using lead and using some other materials that are not considered safe today was a common practice, and people today are becoming even more uh, aware. They scrutinize more. They want to understand. Health from the cradle to the grave is vitally important. And when we see problems, like when you see developmental problems in children, or you see behavioral concerns, when there's a rise in Alzheimer's and dementia and those types of things, we have not seen in history, then people wonders like, okay, what's going on? Is it are we sick or are we poisoned? And so, and it's not something that probably our governmental services want to advertise, even though when they know there is a problem, because they don't want there to be a panic. Okay. And it's quite expensive to remediate. I know Detroit got something like $95 million to address this. Is that enough for all that needs to go on? What's going to happen? People don't want to get their lawns torn up or something like that. Perhaps they get those lines out because they're concerned about their lawns. But our health is of major concern, and we've got to go beyond what the governmental standards are. So I'll say, when they say the water that comes in your home, is it safe to use? Now, you got to realize that the majority of the water that comes into our homes that we use is used for washing clothes and dishes and flushing down the toilet. A smaller percentage is actually used for drinking, okay, and cooking. So there's one level of standard that we should have for again, flushing down the toilet. And it doesn't matter if there was lead in there or whatever. That's not really going to affect you if your clothes get washed, in something that's not pure. But what goes into the body is vitally important. And we're exposed to these chemicals and we're exposed to these metals through drinking, even through bathing. So just think, when you get into a bathtub or you take a shower, we're being exposed on another level. So I say, just like they say, they're responsible for the lines that come up to your home, and then what goes in your home is your responsibility. They're responsible for getting water to us. Once that water gets into our homes, we're responsible for for the quality of that water in making any further improvements. I say we take some self-responsibility, instead of finding out that 20 years down the road or 3 generations later, we should have been doing something more than what we're doing. So water purification, there are ways of getting heavy metals out of the body.
And that's what I wanted to talk a little bit about in these slides here. I really want to get into a lot of the questions are like there was a suggestion of running cold water for 5 to 10 minutes before drinking. And then This is also so unique because the day I got the notice for this was also the day I got my water bill. So if I'm thinking that now I'm going to run water 5 to 10 minutes before I cook every time, and then I drink a lot of water. I'm up to now, I do at minimum 128 gallons a day. And that is from the tap usually because it's just, now I'm thinking I definitely want to consider purification systems that you speak of. And I guess that does make sense. You want to get it at the line where it comes in, and you want to have special care and consideration at where I would bathe and where I would drink. Definitely, I'm very interested in what you're going to share, but it's back to like the responsibility of who pays what line. And I'm sure at the city council meeting, the other question becomes, we're also paying for this, the insurance on like the line from the street to the house. Like it's a private entity that has been supported through the city of Detroit, and I've been paying for the past 3 years. It's like, is that company responsible in any way? Like, can I reach out for that in the insurance of this? And I do have the $95 million question as well, but also they suggested a certified filter of NSF 53 rated. I don't even know what that means. What type of filter should we be looking for with that? They said that if you're bathing, definitely open cuts and wounds need extra protection now when they're thinking about bathing. For infants and young children, the bath time should be made safer. I don't even know what that means. What temperature water is being used? Hot water increases lead dissolution. They're saying for washing dishes, letting water run before sinks, for laundry, proper maintenance of the faucet. I guess this is aerators, for hand washing, proper techniques, cold water first. And basically it sounds like we need to run the water a lot before, and that's going to have impacts on our bill. Like if we run our faucets for 5 to 10 minutes, first off, it's like the timing of that and how much more water are we going to use? Are we going to be given special consideration? And I know these aren't necessarily Dr. Jesse Brown questions, but these types of questions we have with public comment every week about, what consideration now will the water department take on, especially being now that our water department is a part of this Great Lakes Water Authority, where I feel as though the water is in Detroit, and this Great Lakes Water Authority is this connection of these other counties that are outside of the city of Detroit, tapping into what I consider one of the greatest resources. The other questions that I have in our slides about health are, it said, filters at water lines.
Can we take this piece by piece? There was one thing there you said in terms of water. So the NSF, that's a standard for how thorough or comprehensive a filter is. So typically on the I'm not sure if it's on all, but on the better ones there will be an NSF rating. Okay, so the water filtration can be as simple as some cotton and charcoal, like they do with fish filter, you like in the fish tank.
Yeah.
But that's not what you want to have for your drinking water. So it gets out some chlorine and some things, but it's not as thorough. The higher the rating, and the different ratings tell you again, it's chlorine, fluorine, lead, mercury, heavy metals, trialomethane. So there's so many things that go into the water from what we put in the water as individuals and from industry, that everything just doesn't come out in the wash, so to speak.
And
Yeah.
so
So some people would say, some people have I'm calling name a Brita and think a Brita filter is okay.
yeah.
And other people will have a different type system. So for example, for drinking, I've used reverse osmosis for a long time because it really filters down to microns. It really filters down.
What type of cost are we looking at for systems like this?
I've had mine for a while. So if you're talking a reverse osmosis system, is probably in the hundreds, and then a whole house system, people would have to check with different companies. At one time it was exorbitantly high, but that'd be, I'd say probably under, I think under $1,000, maybe under $700 or $500 or something like that. For and there's new systems and more competition and things coming out all the time. I've had my systems for a while, and I've got one system is up underneath the sink, and so I'm changing those filters on a regular basis and things like that. I'd rather it get filtered out there than my body have to try to filter that. My kidneys have to filter that, or that it goes into my body and it's like it's difficult to get it out, or it affects my health. So
There was the question of blood lead level tests.
Right.
It says especially children under 6, pregnant women, elderly individuals, people with compromised immune systems. I do my blood work annually, usually.
Yeah.
This was the first year I did like an allergen test as well. Should we be looking at doing more blood work more than once a year now with this notice? What would you suggest?
Well, I would say ask your doctor, because some of these tests are not typically what you're getting when you're getting a general exam.
Yeah.
Okay. So it's like, if there's something else that's going on, oftentimes that has to be prescribed, written up and then tested. So this is, I don't think this is standard. Of course, I'm not a medical doctor.
Yeah.
But I my understanding, and I get, I go to my doctor on a regular basis and all that type of thing. I utilize our medical system. I just take a holistic approach in what I do for and with my body. But I would check, contact your doctor or healthcare provider and see, and perhaps, I wonder if for those people who have insurances and different types of insurance, because we get a letter such as this, because we get notice such as this, is there a way to communicate with our healthcare professionals or communicate with our insurance companies to find out? It's like, okay, because we got this notice, because we're in a particular, danger zone or whatever area of concern, is this something that will be covered by my insurance? And if not, what would it cost? Is it a minimal cost, or is it, is it expensive?
What is the range in your experience of paying homeowners themselves paying to replace this? Because I've heard it can be, it can be pretty expensive, but I don't really have a sense of that.
Excuse me, of what now?
Of replacing the water service line itself.
Oh, water service, that I don't know. I don't have experience with the people changing the water service line. I don't know what that costs.
So you use home filters and other protective measures in your home?
Yeah, I've got a whole house water purification system.
Mhm.
So, and again, so
Why go that route instead of having the service connection replaced?
Well, one, and I don't know what the cost on that would be for for them to get in there. My approach and in perspective is there are things that are in the water. So even if they change that line, let's say they did change the lead line, you still have a number of different other things that are in that water that need to be pulled out in order for it to be the purest and the safest that it can be.
Mm-hmm.
Okay. So, and this has been a concern of mine and concern, for a long time. So my choice was do whole house, because again, replacing the line would not, it would reduce perhaps the heavy metals or some risk, but not all those other things in there. I mean, even the effects of chlorine, and that's another story. There was a book written called Chlorine, Cholesterol, and Coronaries, and how chlorine and cholesterol impacted our circulatory health and our propensity to get heart disease and atherosclerosis and such. So I say, hey, let me do what I can do on my side, get a whole house system, and then for the point of use, and I've got my gallon bottles when I go to the gym or I'm out outside of my home or whatever, I've got pure water because I've got my reverse osmosis system inside, and that's what I'm using exclusively, unless I'm out of town or out of the country.
I have this question. Also, they said over 10 years they're going to replace these lines, which brings a lot of construction, and it's been a lot of construction.
Yeah.
What would you suggest about just even during those times? Because that more so than anything could cause issues, as that was what the notice even get, in notice of looking at and researching. So I'm pulling this information from different places because I want it to be as substantive, and Malachi's asking questions and I'm asking questions. This is like us in public comment, but also speaking for our own public comment and our own public health safety. As the lines get serviced and changed over, and it's been a lot of work like that, does that impact things differently, just with, I know, the dust particles, but also what possibly could be in the line,
You know what? That's beyond me.
Okay.
The glad to see them addressing the problem, looking at the source of it. I know the city is doing a lot, in the major cities, especially the older cities, are getting federal funding and making some changes because they know that it does impact the health of our citizenry. That's why we need to be politically active and aware as well, and know who's in there and if they're taking care of the people on the planet and all that, if that's their primary concern, or it's the folks that make the dollars. Yeah, I don't know what the impact of the construction is going to be, but hey, if it's going to take them 10 years, I say, don't wait 10 years to find out that it was a problem. Don't spend more money on your cars, your clothes, and your shoes and entertainment than you do on your body. Your body is an investment, yours and your loved ones. A lot of this other stuff, is optional. Okay, but we are too often we spend money on looking good and not enough on feeling good and what really matters.
So with that, thank you so much for coming on the show and giving some information about this. I know you're working on more with your institute. Could you share a little bit about that? And then we'll have like some closing comments, because I'm sure we'll be talking about this in public comment for a couple coming episodes. I even have a couple legal questions and other things to drop in reference to this, but please give the information about what you're working on, Dr.
Okay. Well, the Holistic Training Institute is a state licensed proprietary school that is really geared to helping people learn what they need to do to take care of themselves, their loved ones, and to enter into the holistic health or natural products arena. Okay. We are, as a people, as a country, we are getting more health conscious. Our air, the food, the water, the products that we're putting in, what we can do to prevent and to recover from illnesses in ways that are natural, they're good for people and even good for the environment. So I teach people, and have been teaching people for a number of years, uh, how they can make entryway into this very lucrative and growing area. So as I move towards retirement, I want to teach what I've learned and see that people understand, because the health, our health and the health of our loved ones is in our hands. So many times we think that the government or somebody else is going to do something. It's really the daily choices that we make. It's our diet, it's our lifestyle, it's what we choose to do or don't do that makes all the difference. So people wanted more information, holistictraininginstitute.com. I shared, there's some free classes and there's some that people can get trained and certified in. Again, we need healers in every home and every family. We need people to be aware and to be proactive in terms of their health and well-being.
Thank you so much, Dr. Brown. And you'll be sharing more on our State of Black Detroit for 2024 as well. That'll be December 30th. So stay tuned for that. Thank you so much, Dr. Brown. We have some closing things definitely in reference to this, because I assume it was a very hot topic in council yesterday, this whole thing. Malachi, what was happening? Because I know that's what people were talking.
Yeah, I mean, city council members got a bunch of calls from residents who got these letters and were like, what the heck is going on?
Yeah.
much like the two of us. Yeah, so people were worrying. I mean, council members said that there was a panic. I mean, they council pro tem James Tate said he had people asking him if this was a widespread issue comparable to the Flint water crisis, which is not the case. I mean, we have a lot of lead service lines, but again, the testing has shown that we are within legal limits. The city uses a anti-corrosive agent. The problem with Flint was that they switched the water source and that agent wasn't present. So the lead that was in these pipes and connecting a lot of pipes in the soldering began to leach into the water supply. That's not what's happened here. Again, just to be clear, what happened is everyone got a disclosure notice of lead lines that had been, previously existing. So Gary Brown apologized. He said that he knew that this letter would probably cause a lot of confusion.
You think?
It was based on a template created by the EPA, and actually these were required by EPA as part of the Biden admin rule to remove all lead lines by 2040. So this is part of kind of the kind of regulatory push to get this problem addressed in major cities. But Brown said, yeah, I screwed up here. He apologized. He took responsibility for not providing more context was the key, which I think, a lot of our goal here today was to create a little bit more context and clear up some of these situations. So, ultimately his message was the water is safe. And, this is kind of in line with the city's ongoing efforts to replace lead service lines. They've escalated the pace of that thanks to an injection of federal money. Previously, Gary Brown had been pushing the state to send more money to Detroit. I think we have the most lead lines. I'm trying to remember some reporting we did over the last couple of years as this program was really starting to ramp up. But yeah, I know we know it's been a significant problem in the city. We have a lot of older homes. I mean, this is a widespread problem. The city is putting resources toward it. But, unless it's coordinated with some kind of street project on your block, they are going, neighborhood by neighborhood. But, it could be years until they come your way. So I think that's the concern.
It's stated 10 years. And I know this is where the politics play. Like, what neighborhoods will get selected first? What neighborhoods will get selected last? Also some legal questions that just naturally come up, what individual legal actions could be happening, file complaints with the state regulatory agencies, pursue individual civil claims if you can, demonstrate harm. I mean, a lot of this will become to documenting everything that can be documented. there was a number provided to get the water tested. That number is 313-267-8000. 313-267-8000. So I think that definitely getting the water tested from like just from a legal lens, what they suggest is going to be very key, because I'm sure it's going to be some legal actions that will be taken, because even though I know Gary Brown shared what he shared, people are still like, okay, what's going on here and how do we respond to this? Um, and just the blood lead level testing, as what Dr. Brown just said. I'm gonna be reaching out to look at my blood work and see, like, okay, was lead even tested inside my blood work? And do I need to go back for some more blood work? I usually go once a year, as I stated, but now I'm thinking, we may need to consider that again. And maybe I reach out to my doctor and see what we can do in communities, period, because it's a lot of people that just may or may not know what that test is. I know usually I go in and I say test for everything, but I don't know if that's in the everything box.
That's amazing that you even do that. I haven't seen a doctor in like 6 or 7 years, probably, like, at all, let alone for regular blood testing.
Mhm.
But it sounds like I need to probably start doing that.
I mean, I would say, like they always say, men and doctors, we don't go. It's like, the white coats. But nah, I definitely am big on staying cool with Dr. Paul, Plum Health. You know what I'm saying? That's direct primary care. Um, and I've been going for years just to like keep that monitor of what's going on and how things are happening. And especially when he spoke to this can have a relationship with dementia and Alzheimer's, which I know is present in my family. Um, so I'm going to be very mindful of this, and anybody that knows that that's going on, because we're thinking the nervous system, and also being on top of like what we can do in legal actions in reference to this, because I'm sure it'll be a lot of questions asked. Right now, as we say, like per particle, and you even said what those representative samples are. You're very familiar with a lot of how statistics works, and I'm a little bit familiar with statistics, but there is a representative sample. So it's like particles in housing, how those houses are selected, and what's randomized. I know water is tested daily, no matter what, but still, what that looks like. And also, we're looking at different variances of that water, as what Dr. Brown said. The water in the toilet that we flush is different than the water that we're going to drink versus what we shower or bathe in or what we cook with. So it's only leading to, even reaching out to what Dr. Brown said, figuring out different filtration systems, purification systems. He said reverse osmosis, that alone, just knowing, Lord knows, I gotta go back to high school science to figure out, okay, osmosis, reversing it, what that would be. I'm just wondering at this point in time to send a letter like this, but also not send filtration systems. That alone is like, it just don't fit. It don't sit well, because it's almost like I get my bill, I get this letter, and then 2 weeks ago, I got the other, like, insurance line letter that I'm gonna pay for at the top, before the end of the year. Like, okay, this is costing me money, and now it looks like it may cost me more, because I may need to run my water for 5 to 10 minutes
Right.
before I you know what I'm saying,
I mean,
before I
that
wanna
adds
get a
up.
cup of coffee.
That adds up. I'm not running my water for 5 to 10 minutes to do the things that I'm normally doing anyway. It doesn't take 5 to 10 minutes to fill up a pot to boil pasta, and that's, yeah, I mean, I'm sitting here. I've been kind of clacking away at my computer here because I've been trying to get a free test kit from the city,
Yeah.
and
And how is that working out?
well, they ask some kind of basic questions, but then they also want you to go down into your lead pipe and scratch it and put a magnet on it and do these things to kind of verify if it's actually lead or not. And I just feel like that's really silly, because I have a letter from the government that says that my lead line exists. So I agree. I think it would have been smart to package some test kits with the homes that received the lead line, or something to expedite that process. I'm sure
Yeah.
the city is going to be getting a lot of requests for these test kits now. Um, maybe they could establish something outside, like a rec center or something, where people could go easily pick them up. Because again, I mean, it's like you guys apparently knew that we had these lead lines, and I probably should have known as well. I'm going to take some responsibility for that, right? Um, but if that was the case, why I don't know, why is that not easier? who knows? Maybe I'll get one in the mail in a day or two, and I won't have to complain anymore. But I think that is kind of the thing for folks is like taking the extra steps, like we were talking about all the filtration systems, the extra water. I mean, that's added expense for people.
Yeah.
And that's just difficult. I mean, people just can't, they have a hard time affording some of these things to keep them safe.
And even with it and Dr. Brown's system, he said under like 1,000, and then you get that for every place. So you would get it for the shower. And then if you have 2 kitchens or like 2 places where you may, let's just say 1 kitchen, 1 shower, and what would come in the pipes, I'm guessing that plus the installation. I'm just rough estimate. I'm thinking it could possibly be somewhere between like $2,500 and $4,000. And that's probably not what you be thinking, especially in this time of year where we know the other big bill is about to heighten up in our heat bills. You know what I'm saying? So what that means, how that looks, what that is, help us with more solutions to this instead of the scare. And for Gary Brown to say, yeah, we figured people may panic. It's like, yeah, you knew people was going to panic because I'm pretty sure a lot of people were calling him too. And then this also looms in the whole theories of how other Detroiters have always felt about our water system being the gem of our city and our neighboring suburbs looking to take that gem away. So this Great Lakes Water Authority, it just sits in the hearts and minds of so many people is like, is this because of that? You know, not saying necessarily that there's any correlation between it, but it looms as if what's going on. And we'll definitely be reaching out to Monica Lewis Patrick about this soon as well, and many others. But I'm so glad that Dr. Brown was on to just give some straight up solutions on like looking at that reverse osmosis. I'm stepping away knowing, and also knowing that like, okay, you should look at some type of system as the water comes into the house and then other systems as they go throughout. Now we know that the NSF is just a rating of what type of filtration that is. And now we can at least explore what level of NSF that is, and also looking for other things and other metals that could be in the waters. Because, hey, we're there now. And if we're going to be there, let's fix this the whole way through, as he stated. Malachi, this was a overtime of it, but I knew this was probably going to be an overtime episode just considering everything, man. But what's happening with Bridge Detroit?
Yeah, there's so much that happened at that council meeting we didn't even get to, but rightly so, because this is extremely important. So yeah, go on bridgedetroit.com, sign up for our free newsletters, and you will get my weekly city council updates. Sometimes I also do other newsletters on various topics that I'm writing about. But those are also posted to our website, again, bridgedetroit.com. So you can read through. I mean, they're very comprehensive. I feel like these things always end up being some of the longest newsletters that you can probably get in Detroit. Hopefully that is valuable for somebody out there.
Oh, yeah, definitely.
But yeah, what we do, we're a nonprofit newsroom. We rely on donations and foundation support, and we do not charge people for our content. So if you're trying to pick between buying a lead testing kit and a news subscription, you don't have to worry about that with us. We're all free. Never ask you to pay for information that you need. Yeah.
Mm-hmm. Definitely. And Detroit is different. A couple different things coming up. As much as State of Black Detroit is coming up, our year-end discussion here with Public Comment and so much more will be moving forward with Public Comment 2025. That'll be coming up soon. We haven't figured out the date, but I'm pretty sure now we got a big topic that's going to be inside of that as well. Man, oh man, it should not be this funny. But Bishop Bowinkle got a song about this. It was like, hell to the no. It's like, ain't this something? It's like everybody was feeling like Bishop Bowinkle. Ain't that something? But with that being said, Detroit is different. A lot of other cool stuff happening. Coming up, we're doing another playlist live with Orlando Bailey and Donna Gibbons. You know what they do at Authentically Detroit, and Detroit is different. Come together, we make a playlist live, and it's going to be fun at Miss Eva's, the Speakeasy, right in Rosedale Park. It should be fun. I'm gonna try to even get Malachi to come out for that one. All right. So we rocking and rolling. Peace. You're watching Public Comment every Thursdays at 8 a.m. The live stream. Detroit is different, and Bridge Detroit. Local politics of Detroit.